surgical techs or surgical tech students. This is a lap Coli setup. As you notice, I prepare things as as you can see. I'll prepare things as much as possible. So basically, in the inter-op part of the case, I don't have to keep thinking about what I'm supposed to do next. Basically, I just continue to have a natural flow with the surgeon. As you can see, I have the draping stuff ready, all the tubing. It's located on top of a towel. Underneath is my setup. You can see a little peek at it right there. But underneath the towel is the setup for the lap Coli, and on top I just have the camera, the insufflation tubing, the irrigation suction, the light source, and also the cautery source right on top of a towel. And then underneath the towel, I'll keep all my instruments. And as I pull my mayo up and I set up the tubings, I'll unveil the instruments for the lap Coli part. I really don't put a lot of stuff on my mayo. I put exactly what they'll use. If they use something else, I'll just grab it from my back table. And as we move on, as you can see here, I have cholangiogram set up. I have, they use IV saline, and they use IV dye, whatever dye it is, whether it be Reno or whatever institution you're at, whatever they use. But anyway, I have the IV dye set up and a bowl for the saline, if you can see it. I have it labeled, and I have the syringes labeled. Make sure you label everything, not leaving anything without labels, in case someone relieves you, or so there won't be any mix up with drugs or anything. I label everything. Some institutions have labels. Some of them have just a marking pen and some steri strips, and you can label it yourself. But here we go. As we move on here, I have my instruments set up here. You need basic instruments to do even though if it's a laparoscopic case, you still need basic instruments. I tend to keep them neat in case we have to open up. I can easily grab them. I try to keep a neat setup in case of I anticipate anything as far as opening up. So as you anticipate, you kind of like set your mind when you do your setup. You kind of like set your tone to where you anticipate anything can go wrong, and you want to be prepared for that. I have my lap Coli instruments lined up right there. I have two David & Geggs, a Maryland dissector, one grasper with teeth. I have what they call it's a stone clamp. It grabs stones right there. And then the last one is a mother-in-law. Is one of the clamps with big teeth on it. Anyway, I try to prepare my dressings to get them ready. I cut my steri strips in half. I have a lap in a bucket ready to clean and then put on steri strips. Here for the prepping, they use paper around here. This is one of the institutions I work at, but they use paper. And here I have, I get it prepared. I take all the white tape paper off and get it ready for draping, so it could be a quick drape, surgeon's gown and gloves, and some backup cameras and stuff like that. I accidentally dropped on this setup, I accidentally dropped the light cord a little low, and I got rid of it, so this is why I have two cameras on my field. If you drop anything low, don't be afraid to say you did. Make sure you maintain your sterility, and make sure you maintain your aseptic technique. Don't be afraid to let something go and admit that it is unsterile. Make sure you keep your sterile conscience at all times, because we're here for patients, and they're not looking at us, but you still have to have your conscience, and you want to make sure that you give that patient the best chance at surviving. At survival. Make sure that they don't get infected. Make sure that you're prepared, and make sure that you keep your your sterile conscience at all times. Basically, that's it for my lap Coli setup. I basically set up the case a couple of minutes before the case starts, so I have time to do this. I'm going to be sending more videos through YouTube, and this is one of my first videos, so the narrating is a little weak. I'm going to get better at this, but anyway, and here I am. I got my gown and gloves ready to go. As soon as the patient comes in the room, we'll basically position the patient, prep the patient, and get the patient ready. The patient has to go through a series of getting anesthesia. For all your new students, you should stay scrubbed. For your experienced people, break scrub, relax a little, take your time, make sure you have everything before you break scrub. And, just keep it rolling. My specialty is orthopedics, but I also do everything else. And, this is just one of my first videos. I decided to send videos to help students, to help other surgical techs and other people, get accustomed and get into this field. This field is a very good field. I really enjoy doing this type of work. And, lap Coli is it's not a difficult case, but it's a case that, you just have to pay attention and make sure you know your anatomy. You know that they have to ligate the cystic artery, cystic duct, and then they dissect the gallbladder from the liver and they pull it out. Basically, that's it. So what you're looking for while you're doing a laparoscopic case, being that it's a laparoscopic case, you're looking for complications are bleeding. You're looking for bleeders and making sure that your irrigator is ready to suck and making sure your bovie is connected. They have a laparoscopic bovie. Some people use the Maryland dissector with the bovie cord, and they use that to bovie the bleeders. No panicking, never panic in cases. Never ever, show anyone that you're out of control or you're panicking or anything of that nature. Continue to progress in this field and represent this field in the correct way. All right, I'm out. Lap Coli, I'm out. I'll be sending different videos at times. Please keep checking for me on my videos, all right? I'm going to be sending better videos. This is one of my first ones, so you guys out there, just keep looking for me. We can't really show patients because it's against HEPA rules, but again, we'll be going over setups, and sometimes I might be able to slip a video in there if it's okay. If they're filming or anything like that, I might be able to do my own videos and send them on YouTube. But keep in mind, my videos are to help and to progress this field. All right, I'm out. Peace. All right, that's me, dog. That's me.